Good afternoon. Thank you guys for joining us here in Miami. I'm happy to have the Lieutenant Governor, happy to have our State Surgeon General, Scott Rivkees, happy to have our Deputy Secretary for Health, Dr. Shamario Robertson, and also Richard Corcoran. And then I see we've got the mayor, we've got some county commissioners, we've got Representative Bush, so I want to thank them as well. As you know, last night the department announced that there were 2 presumptive positive cases of 2019 coronavirus in Florida. As of about noon today, we've finally gotten confirmation, verification from the CDC. So those are 100% verified cases of coronavirus in the state of Florida. The first patient is an adult resident in Manatee County, did not have travel history to countries identified for restricted travel by the CDC. He has some significant underlying conditions, had been in the hospital. He had initially not qualified as being somebody that was to be tested. The change in guidance happened late last week. He was tested because he developed some of the symptoms and then tested positive. The second patient is an adult resident in Hillsborough County with a history of travel to Italy. We also think that the individual has a roommate, sister, maybe both, who may have been traveling as well or who have been in contact since then. So in total, as of today, 23 people have been tested. State is currently monitoring 184, and since probably, would you say, late January when we started to monitor, a total of 795 have been monitored. So the 2 individuals who've tested positive remain in isolation at this time. Despite these cases, the overall immediate threat to the public remains low. And the doctor has stressed that, CDC has stressed that, that guidance has not changed. Now that said, we do anticipate to see more positive cases in the state of Florida, and we have taken additional actions to help contain the virus's spread. It's also important to know that this is a virus, if you look, and we don't know everything about it yet, but really if you're younger, healthy, people tend to weather that. If you have an underlying health condition or you're elderly, those have been the 2 groups, not always mutually exclusive, where the virus has had a big impact. So last night I issued an executive order establishing DOH under Dr. Rivkees as the agency responsible for the response and coordination of the relevant state agencies for the COVID-19 response. I also directed the Department of Health to declare a public health emergency to better equip our state with the resources needed to handle the emerging threat. This emergency declaration ensures that healthcare providers, hospitals, and labs immediately report all suspected cases to the Department of Health. It also advises individuals of the proper protective measures that need to be taken regarding the possible exposure to COVID-19. Individuals that have traveled to an area that the CDC has issued a warning level 3 or alert level 2 health notice, or those that have been in contact with somebody who has recently traveled to those places, should immediately contact the Florida Department of Health upon developing symptoms. These symptoms include fever, cough, shortness of breath, or difficulty breathing. Current countries listed at level 3 travel health notice include China, Iran, South Korea, and Italy. Japan is at an alert level 2 health notice, and the administration in Washington is now doing monitoring for Italy travel, both before flights are boarded and then when they arrive into the United States. Because the virus it performs, I guess it's most serious when you're talking about elderly folks, I've asked Dr. Rivkees to work with Secretary Mary Mayhew to ensure that our assisted living facilities and nursing homes are taking adequate precautions. If you have somebody who's been in those areas, you should certainly be screening that before you let them have access to a facility with a lot of senior citizens. The Florida Department of Health has been fully engaged from the beginning with their response and epidemiology teams working on this issue since the first week of January. When somebody came from China, say, in late January, February, as all this, started to come to a head, even if they were not in the Wuhan section, they would come in, They were under self-isolation. The Department of Health would monitor them. And so that's hundreds and hundreds of people that was done. Of course, if you came from the immediate affected areas in China, you were in quarantine for 14 days before you could even be released to Florida. None of the flights that were leaving Wuhan came to Florida. They were all diverted to other airports throughout the country. So there's been a lot of work that the Department of Health has put into this from January until the present. We are now able here in the state of Florida to test for coronavirus. We have labs in Tampa, Jacksonville, and Miami. Now, because the tests that two positives were the first tests that were done in Florida, the CDC did not have 100% confidence. Not that there's anything that anyone did wrong, but, you know, these things, you got to do it right. So they had us rush samples to them over the weekend, and that's when they were able to confirm the positive test this afternoon. What we'll be able to do with these tests, though, is to get 24 to 48-hour response. When we send it to Atlanta, it's about a 3 to 5 day response. We also have an incident management team in place and are working in lockstep with the CDC, receiving multiple updates daily. We have hundreds of dedicated professionals in the Department of Health that are responding, including staff in Tallahassee and in each of our 67 county health departments. We've also engaged the medical community through correspondence and weekly calls and have established a DOH website related to COVID-19 at www.floridahealth.gov/COVID-19. This is the best and most up-to-date source for information and guidance regarding COVID-19 in Florida. I've also spoken with Speaker Oliva, Senate President Bill Galvano. We may be asking for some contingency funding for this. And they both were receptive to making sure that the state's needs were met. So we just ask people to listen to the advice of the CDC, local healthcare professionals. We think it's prudent to really be working to get ahead of this. At the same time, it's important to say, the risk to the public remains low. And, even people who end up contracting this, the vast, vast majority are not going to require hospitalization or anything like that. Now, obviously, we're going to try to contain it as much as we can. But the daily life continues. Take the precautions that the CDC and our Department of Health is recommending. I mean, doing things like washing your hands and not touch really does make a difference when you're diligent about that. So we appreciate everybody who's been working hard on this really from the beginning of January. We started talking to Jeanette and Scott and everything, and we. Is it good? You got it? Okay. So with that, I'm going to bring up the Lieutenant Governor to give some remarks in Espanol.
Well, good afternoon, and thank you all for being here, and thank you to Governor DeSantis for his leadership on this issue, as well as our Surgeon General, Scott Rivkees, and the entire team at DOH. Buenas tardes, muchas gracias por estar unidos con nosotros aquí en el Departamento de Salud, en el Condado Miami-Dade. Estamos aquí con el Gobernador DeSantis, el Cirujano General del Estado, Dr. Scott Rivkees, el Secretario Adjunto de Salud, Dr. Roberson, y el Comisionado de Educación, Richard Corcoran, y además con muchos oficiales electos, para proporcionar una actualización sobre coronavirus COVID-19. Anoche el Departamento de Salud anunció que hay 2 casos positivos de enfermedad de coronavirus. Nosotros esas muestras laboratorias las mandamos a la CDC para confirmación, lo cual, como viste el gobernador mencionar, hace más o menos una hora ellos confirmaron los 2 resultados positivos. El primer paciente es un residente adulto del condado Manatee, sin antecedentes de viaje a países identificados para viajes restringidos por la CDC. El segundo paciente es un adulto residente del condado Hillsborough, con antecedentes de viaje a Italia. Las 2 personas que han resultado positivas permanecen aisladas en este momento. A pesar de estos casos, la amenaza general al pueblo es baja. Queremos reiterar que la amenaza inmediata al público México sigue siendo baja por la CDC. Pero claro, queremos que todo el mundo esté al tanto y deben de tomar medidas para protegerse, para asegurar que nosotros estamos siguiendo las regulaciones de la CDC. Le pedimos a los residentes que por favor tomen las medidas adecuadas para la protección personal, incluso lavarse las manos frecuentemente, asegurar que no, si están enfermos, por favor no vayan al trabajo o manden a los hijos a las escuelas. También cubrirse la tos y los estornudos. Anoche el gobernador DeSantis emitió una orden ejecutiva que establece el Departamento de Salud bajo el liderazgo de Dr. Rivkis como la agencia responsable por la respuesta y la coordinación de todas nuestras agencias estatales en referencia de COVID-19. También esta orden se declaró una emergencia de salud pública para equipar mejor a nuestro estado con los recursos necesarios para manejar esta amenaza. Las personas que han viajado a una área en la que la CDC ha emitido un aviso de salud de nivel 3 o una alerta de nivel 2 o aquellas que han estado en contacto con alguien que ha viajado a esos lugares, por favor deben de comunicarse de inmediato con el Departamento de Salud de la Florida si síntomas se están desarrollando. Esos síntomas incluyen fiebre, tos, falta de aire o dificultad con respiración, y los países actuales en un aviso de salud de viaje de nivel 3 incluyen la China, Corea del Sur, Irán y Italia. Japón se encuentra en un aviso de alerta de un nivel 2. Para evitar el riesgo de propagación, la emergencia de salud pública también aconseja a las personas que creen que han estado en contacto o expuestas el COVID-19 que se comunican directamente con el Departamento de Salud. Y esas son las medidas que estamos tomando. Estamos en consultación con la CDC, estamos tomando todos los pasos apropiados para asegurar que estamos manteniendo la amenaza en control. Así que de nuevo le agradezco al Dr. Rivkis todos sus esfuerzos en esta respuesta, y ahora lo voy a llamar para que él pueda dar unas palabras.
Thank you and good afternoon. I'd like to begin by thanking Lieutenant Governor Nunes and Governor DeSantis for their engagement and tremendous leadership on this important issue. As the governor mentioned, we now have 2 confirmed cases of COVID-19 in the state of Florida. The Florida Department of Health is working closely with these individuals and their close contacts, their healthcare providers, to isolate and monitor individuals who have been exposed to them, and implementing testing for anybody who may develop COVID-19 symptoms, which include fever, cough, and shortness of breath. Since we have 2 cases of COVID-19 in Florida, I would like to announce several measures that our residents and visitors can follow. First, regarding travel. Before planning travel overseas, please refer to the CDC website, which identifies areas of concern. In addition to China, there are large outbreaks of COVID-19 in northern Italy, South Korea, and Iran, with more than 1,500 cases in these countries. If you are returning from these areas, we ask that you self-isolate for 14 days upon return. You can refer to the Department of Health website for guidance on this. This basically means staying at home and monitoring yourself for signs of illness. If you become ill while you're staying at home, please contact your county health department or medical provider before seeking medical care. We will provide proper guidance and ways for which you can be tested for COVID-19. Regarding healthcare workers and healthcare facilities, all healthcare facilities and workers should review current COVID-19 guidance. There are new guidelines for testing individuals. If an individual is hospitalized and has lower respiratory disease of unknown origin, they should be tested for COVID-19. Please contact your local county health department and when you're evaluating such individuals, and we will help assist in the evaluation and collection of samples. And as the governor mentioned, we are now testing in Miami, Tampa, and Jacksonville laboratories. Hospitals and care providers are also reminded that individuals who are being evaluated for or hospitalized for lower respiratory tract illness should have either respiratory or aerosol precautions in place. Please refer to CDC and Department of Health guidelines for this. We need to protect our medical workforce who may be exposed to individuals with COVID-19. Regarding nursing homes and other residential facilities, recently an outbreak of COVID-19 was identified at a nursing home in the state of Washington. Please review your visitation guidelines and consider restricting visitors. Please screen all visitors for sign of illness, and if anybody is ill, they should not be visiting. As far as university and colleges, these are areas of high-density interactions and housing, and many have international programs, as do some secondary schools. Please evaluate CDC travel guidelines. If you have students who are returning from high outbreak areas, please assist these individuals in self-isolating for 14 days. And again, if these individuals become ill, please contact your local county health department. And as the governor mentioned, the risk to the general public is low. Please go about your normal business. The best way to prevent illness is to avoid being exposed to this virus. There are certain recommendations that we all should follow. Avoid close contact among individuals who are ill. If you are sick, stay home. Don't go to work. Don't go to school. Cover your cough or sneezes with a tissue. Wash your hands with soap and water for at least 20 seconds. This can get virus off of it. And clean and disinfect surfaces that are frequently touched. Today is an important day for all of us. We will continue to provide regular updates as this is a rapidly evolving situation. Please refer to the Department of Health website. This also has links to the CDC website. The Department of Health has been fully engaged to support the public since we first became aware of this. We are doing everything we can at the present time to prevent further spread. Thank you.
I'd like to bring up Dr. Robertson.
Just want to reiterate, we have an integrated public health system in Florida with 67 county health departments and 3 public health laboratories and many partners that we're working with to respond to COVID-19. Again, please remember, if someone have traveled to the affected regions, China, South Korea, Iran, or Italy, and have symptoms of fever, shortness of breath, or cough, or have been in contact with someone that has laboratory confirmed COVID-19, it is very important that they call the county health department to facilitate going to a healthcare facility. In addition to that, if someone is in the hospital and they have severe respiratory illness without other diagnosis, for example, flu, then they are eligible for COVID-19 testing, and that healthcare provider should work with the county health department. This is what a person can expect if they meet this criteria. So a person can expect to have 3 different specimens taken: an oral swab, nasal swab, or sputum or saliva. Those are the 3 types of specimens that will be collected. Once those specimens are collected, then the healthcare provider will give them to the CHD. That county health department will then make sure that those specimens are either shipped or taken to one of 3 public health laboratories. Currently, the approximate time for results from our public health laboratories in Florida is 24 to 48 hours. And if positive, we are currently working with the Centers for Disease Control and Prevention to confirm these test results. Additionally, it is important to note, once we have a presumptive positive in Florida, we are taking all necessary public health measures to prevent the spread of the disease and isolating those individuals. I just want to reiterate, we are poised, working with the Centers for Disease Control and Prevention and other partners to respond to COVID-19 in Florida. It is important to note that the risk to the public is low at this time.
Great. Thanks. Anybody have any questions? Yes?
Can you confirm whether the hospital in Sarasota is currently in quarantine, and if so, do you know if that number of workers is 80?
So, I mean, I don't think the entire hospital is, but so this was an individual that was in. He had a lot of underlying conditions. He had interaction with different healthcare professionals. Once the guidance changed, where he was then in the window, he was tested, and then all the protective measures were taken. Then once he tested presumptively positive, there was an epidemiological investigation. So all those people are being traced. I think many are in self-isolation. Obviously, if any develop symptoms, they'll be tested. So one of the things that we've had some of the hospitals ask us is, okay, if our professionals are exposed, they're going to take the necessary precautions, but we could end up shorthanded. So I think that's an HCA hospital. So I'm looking at ways to waive in some of the out-of-state requirements so that they can surge some people from areas where maybe they weren't as affected. So we're looking to be able to help them with that. Absolutely.
So it's fair to say a part of the hospital is under quarantine, but you don't have a number of them?
I don't think it's not fair to say the part of the hospital, just some of the employees, correct?
Yeah.
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 Can we go Spanish and English?
Oh, yeah.
Oh, okay.
So my
Sí.
question is, will the state cover the tests the cost of the test for those who think may be infected?
Okay, do you want to give the English answer on this one?
So the COVID-19 tests that are sent to the public health laboratories does not have a cost.
No hay un costo con lo que es el laboratorio, las muestras de laboratorio que mandan a los tres centros que son en Miami, Jacksonville y Tampa. Esas muestras de laboratorio no tienen costo.
Great.
Are there any answers as far as how long after possibly contracting the virus will it be contagious for? Is it, I know the quarantine is 14 days to show symptoms, but...
On the front end too. How long on the front end and on the
Yeah,
back end?
yeah. Thank you. This is a new virus that we are still learning about. There's a possibility of individuals spreading the virus before they become symptomatic. For the flu, typically individuals who shed virus for a day or two beforehand. We don't know exactly for this. And then the other question you're asking, after somebody has COVID-19, how long do they shed the virus for? Again, this is an unanswered question, but typically when individuals have respiratory infections and they're no longer symptomatic, they stop shedding, but we don't have the full answers on this. Thank you.
We'd also like to, just with the, in terms of, we encourage people to get flu shots. Symptoms are similar. If we end up in a situation where people are surging in to seek medical care, if most of those people are flu and that could have been prevented, then that obviously lessens the resources. And so we have, those are available for folks. Now we are obviously hoping that, I think the flu is going to start dissipating a little bit as the weather gets warmer. We don't know whether COVID-19 will do that. Hope so, but we don't know. But certainly to have fewer flu cases in Florida, I think helps our ability in terms of combating the spread of COVID-19.
Any guidance on spring break, especially with Ultra and spring break coming up?
Spring break, both of you wanted spring break? Yeah, no, it's a concern. So we've, been in contact with all the universities. We have a lot of people who go over to places like Italy, studying abroad, but then now is kind of the spring break, so a lot of people are coming back for that. And it's obviously a concern. And so Dr. Rivkees has worked with Commissioner Corcoran, the Board of Governors. So there's guidance in place on that. But we'd obviously say, I mean, if you're coming back from a place in Italy that's had an outbreak, particularly if it's spring break, stay at home. Follow the instructions, follow the guidance. Because when you're in a place like a university, going back into that, that obviously could create a potential for outbreak. So just be cautious about what you're doing.
When did he check into the hospital? How many days were in the hospital before?
Was he on last Monday, or do you know which day?
Yeah, the gentleman who was hospitalized, he was hospitalized for about 5 days
before the test? I mean, before Saturday or before yesterday?
before he was tested.
With the amount of international travel here in South Florida, is there any particular concern that you have because of all that international travel and mixing within the community?
Well, obviously, I mean, you guys know we have 125 million visitors a year here. I mean, you have people coming, whether it's plane, whether it's driving down. I think what the administration did with the restricting the Chinese travel has been very helpful. And I think both Dr. Rivkes and I, when we met with the Vice President, we strongly advocated for stronger measures with respect to Italy. And so now what they're going to be doing is they're going to be screening prior to boarding in Italy and then also on the back end. And then those who are potentially symptomatic can be put into self-isolation. So yeah, I mean, it's just a concern because we're in an interconnected world. But I think if they continue with the areas where you've had outbreaks and you have measures in place, I do think that will make a positive difference for us.
Governor, you mentioned that the testing is...
that you can have in your home should you end up with this illness in your home for 14 days? Any recommendation in terms of lessening the severity of the symptoms? And also food. Some Floridians are preparing us if this is a hurricane.
Scott?
Thank you. First, let me emphasize that we don't have any known community spread widespread within Florida. So please pay attention to that. So as far as the preventative measures that we talked about, hand washing, staying away from individuals who are sick, that's the best way for us to be able to protect ourselves. If we get to situations where there appears to be community spread, then we will have additional guidance at that time.
You don't think Manatee Man was community spread?
Manatee County is believed to be community spread.
Well, it's under investigation. I mean, so he had no, at least reported travel from any of these places. So we know that. We don't know who he's been in contact with. So this investigation is tracing all those contacts, and then we'll see. So we don't have all the facts on it yet. Hopefully, we will, and obviously, we want to report those as soon as we do it. But we also don't want to put out anything prematurely if we don't have the actual facts.
Did anything come up in the call with Mr. Pence about protective equipment that
Sure.
health departments have, and also specialized hospital rooms where there don't be enough?
So on the former, yeah. So they have the ability to surge equipment from CDC, which is good. Scott has some equipment stockpiled as well, and so that's great. And I think that as part of whatever supplemental funding is passed by the Congress, which I think we will see, but who knows with them, then that obviously could be used. And so what the Vice President is envisioning as a former governor is, look, you guys need to be able to combat this thing, so you guys do what you got to do. We will appropriate money and then simply reimburse you on the back end. And so I think that probably would work well for us. They are, there's a huge uptick in protective masks and things that are going to be produced by some of these companies now in response to this. So I think that's good. In terms of the hospital didn't come up, but we're mindful of the fact that, okay, this COVID-19, 80% of the people who acquire it at least are not going to require hospitalization. I mean, they're going to be relatively mild symptoms. You have this guy in Manatee had some serious underlying conditions, so he was hospitalized anyways. And then you have and then people that are elderly, obviously. And so in terms of going to the hospital, we're not recommending just the average citizen, if they start coughing, just show up in the emergency room. That's not going to be the most effective way to be able to limit the spread of this.
Any concern that the Vice President was in any way exposed during his visit to Florida?
No, I don't think so. I mean, no.
You said the woman has a roommate. Is she a student, or is this her sister? What is, you said she was sure she's a resident of Florida.
That's why I want to make sure we have all the facts. So we think that her sister either traveled with her or was exposed when she came back, who's a resident of California. But we also heard reports that she had a roommate as well. We're not sure whether she traveled, and so we think there's probably 2 people who were exposed. And so if the sister, for example, tests positive, just so you know, that will be a California positive. Just that's the way they do it if that's the residents. But they're in self-isolation now, and we will be getting test results back hopefully within the next day or 2, right? Is that what you anticipate? Yep. So, Mayor.
You were concerned last time you met with us about not being able to do the test locally. In Spanish, have those concerns been alleviated after meeting with the governor? ¿Se pueden hacer ya las pruebas localmente sin tener que llevarlas a Tallahassee?
Sí, no tengo esa misma preocupación. Estamos comunicando con el gobernador, todas las agencias del estado de la Florida. Acuérdate también que esta no es la primera vez que tenemos este tipo de evento aquí en el condado de Miami-Dade. Hace 2 años tuvimos el Zika y siempre estamos cooperando con el estado, con el gobernador, y nosotros fuimos el único gobierno que paró el Zika. No estoy diciendo que eso se va a parar aquí, pero esa cooperación con el estado de la Florida, con el Centro de Enfermedades Federales, es vital para nosotros aquí en el condado de Miami-Dade. No estoy preocupado ya porque ahora tenemos un laboratorio aquí que está haciendo las pruebas. Así que para mí eso es buena noticia.
Let me just, I'll let him go. Just let me say with the testing, so we do have now the 3 test centers in Florida. They are working, and we don't know that it's going to happen tomorrow, but they are working on getting the ability to test in some of these facilities, so in a hospital or some of the doctor's office. And so how many kits? They have like 15,000. So it's going to take a little bit of time to get out, but that will also speed things up and make things 15,000. That's right.
Announced 3 more deaths in Washington State, be it that Florida is the home of retired communities. Anything you have to say about the elderly in Florida?
Well, first, I mean, I think our condolences to the people in Washington State. I mean, I think that was very unfortunate. But yes, these assisted living facilities, the nursing homes, places that have a lot of senior citizens, particularly those who may have medical conditions, you absolutely need to take proper precautions about who's being allowed in those facilities. I mean, to let somebody come in who had just come back from Italy, who has symptoms, would be a huge mistake. And so, we're going to be working proactive to deliver that message as clearly as we can. But we certainly are concerned, given our demographics, that if that's not, if those folks are not watching who's coming in, then you could end up, seeing this virus transmitted, and that would not be good. So, okay, thank you guys, appreciate it. You guys are coming.
Thank you, sir.
Yes.